Vincent's Mobile Health Outreach Ministry is basically a doctor's office on wheels. We provide free health care to the uninsured here in Duval County and also in 5 other counties.
I personally believe that being educated is the first step to prevention. So getting our students to the care unit early on, making it a part of their lifestyle so that they understand that visiting a doctor is something that's important to them, that going to a nurse or having regular physicals or regular exams are important, goes a long way toward prevention. Our parents are very much a working body of individuals. Aside from the fact that they are sometimes working 2 and 3 jobs to live and survive, many of them also don't have health care.
I think if it wasn't for St. Vincent's and for the Mobile Health Outreach Ministry, for the CareMobile being here and being at the school and having the partnership that we do with the school system and with the school nurses, I think there's a lot of people that fall through the cracks. You know, they're hardworking people, they have jobs, but yet for whatever reason they're unable to either afford health insurance or it's not provided to them through their job. They have nowhere to go. And we build relationships with those patients.
We're looking to service the whole child and to make them a well-rounded student, and therefore they have the unit here where they can go, and all we have to do is get the parents' consent. You know, just say yes, let them do it, and we'll take care of the rest. And so it's really a benefit for them.
But what we've found on the majority of these kids, over 90% of the kids that we've seen, they have elevated insulin levels. That particular lab value, which is abnormal, is a hint to us that they're utilizing their insulin stores in their pancreas at too rapid a rate. And those are the kids where if you make the interventions now, change their diet, lose weight, you can change their lives. And as you change their lives, you're changing the lives of their families and their future families. And so there's that impact, the domino effect or ripple effect, whatever you want to call it, where by changing a life early on, you not only change their life, but you change future generations.
We're not just a school in the community, we're a community school. And therefore, anything that can be done within the school family to benefit the whole child, to benefit the whole family, is ultimately going to have a great impact on the children's lives to come. It builds a foundation within the community that medical services are important, that quality healthcare is important, and it changes your quality of life by having the type of healthcare that you need.
I think that we provide help to students in the schools and to adults in the community that have nowhere else to go. They would end up in the emergency room, or they would end up going nowhere.
I don't know the numbers about the amount of people that have diabetes, hypertension, the persons that don't have an insurance in the city, but I know it's immense, it's huge. And what we offer here in regards to treating blood pressure, treating diabetes, high cholesterol levels, these people wouldn't be able to get it anywhere.
Well, I drive a school bus, so it's getting a physical once a year, and they said, well, I'm diabetic, and they've been supplying my medicine. He's my primary doctor, actually, so I rely on him totally 100%. The service here is great, no discrimination, total confidence in them, and I'm very, very satisfied with the help they provide me and my wife, because she's asthmatic, and she's also, this is her primary doctor now, so I treat her very well, and I really like it. I'm glad it's here. Trust me, I'm glad it's here.
Once the person goes through those doors, they're mine. You know, they're not a number anymore. We try our best, to let the patients know that we're not here to judge them. We're not here to know where they're coming from. We're here, they're patient. We care for them. They're a person. Educating the patients is a huge part of our ministry here.
Sometimes he cares too much, but he's a wonderful doctor. He's really concerned about your total being, about your total lifestyle and what you do and what you need to get done. He goes over it over and over again, drills it into you like what you need to do. Very, very caring.
I always tell the patients, it's 80% you and 20% us. I think they take that to heart and they slowly change.
program that we do is with our migrant farm workers. And these are farm workers that live about 70 miles from here. They work in the potato fields and the cabbage fields and also in the ferneries. Some of them have large families. Most of them in the family work on the farms there. And they have no resources for health care.
She called me on the phone, and then she told me that she was having a lot of problems with her knee.
Then later, when I couldn't walk, my coworkers would have to carry me out, and I couldn't work a full day. That's when I sought out for help to get myself better.
My mom her legs would be starting to hurt, and she would have a lot of pain.
I told her to come up to the unit, and that she says, come, I says, to St. Vincent's to see what the doctors can tell you. And that time we saw the knees very swollen, they were swollen, the whole leg was swollen. I says, what's wrong with you? She says, I cannot walk, my knee hurts.
I would just think about the future of my children, and that's what hurts the most. I think to myself, if I don't work, what's gonna happen to my kids? That's the big problem for me.
They saw her. They said, we are going to do x-rays and MRI. And that's what they did. And she knew after that what was wrong with her. It was osteoporosis. She has to see somebody else, a specialist on the knees. And that's when I helped her to get one. With the specialist, but all the meds, everything, St. Vincent paid for it. She's doing much better. It's amazing because I remember the first time I saw her when she couldn't walk.
She's better than a sister to me. I don't have any sisters here. She's a very good person, and she's helped me out tremendously.
I think that she's a good person because she helps other people who need help.
Families, they're born into poverty, and then they see that as that's how it is, you know. We're helping them breaking the cycle, really. People that they have been in the streets for many, many years, and they never trust anybody. But once they get here, they feel, oh, this is great. I definitely find some people here that they really care for me, you know.
It's a blessing because these people are not here just because it's a job. This is something that is in their hearts, and they do it out of love.
St. Vincent's mission has always been to take care of the poor and the underserved.
St. Vincent's has a servant's heart. They're going to do what's right. And if you need medical care, they're going to provide it in one way, shape, or form. They're going to provide your medications for you, whether you can afford them or not. They're going to do the right thing.
I feel like God has placed me here for a reason, and I feel that every patient that we see is an opportunity to change their life, and that may just be the way that we greet them at the door, you know. But I really try to view every patient as a kind of a divine opportunity, and I'm very thankful and grateful for this opportunity to work with St. Vincent's.